Egg freezing is a modern method by which the eggs of the woman are extracted and can be frozen in liquid nitrogen and kept in that situation forever. Why has it become popular these days? Now we have to understand that over the last 100 years, the age of the woman who is getting pregnant is shifted by almost 10 years. So if it was in the early 20s, 100 years back, it is now late 20s or early 30s that women are now taking a pregnancy. There are a lot of reasons for that. They're getting married later, they're studying for longer time, they're all pursuing a career or they're working elsewhere, and sometimes they just don't want to have a child because they're enjoying life. Now all this is fine, and I think women have a right to this. The problem that happens is women have a biological clock ticking. Remember, they have a fixed number of eggs and these eggs are exhausted over time. So a younger woman would always have more eggs and therefore a higher chance of getting a child. Now if somebody wants to delay motherhood or getting pregnant to a later age for whatever reason, that's perfectly understandable. But a body does not respond later on and may not produce good eggs when she's actually ready for a child. In such situations, it is recommended that she goes for what we call social egg freezing, which is she doesn't have a medical reason for freezing her eggs, but she is doing it for social reasons because she is not prepared to have a child just yet. She undergoes what is a standard IVF procedure. She takes stimulatory medications. The eggs are grown up. Sometimes 10 or 12 eggs can grow up together. Those eggs are then extracted of her body through a needle, through a process known as oocyte retrieval. These eggs can then be stored for her to be used whenever she wants. This is a highly effective technique and has been recommended in many societies by many companies as well as a method of ensuring, I would not say ensuring, a method of increasing the chances of having a child later on. We must remember here that the eggs that have been extracted in a particular month or a particular cycle by no means guarantee a child later on. And freezing of oocytes cannot be looked as the best option for motherhood. Trying naturally stays number one. But for some reason, if that's not possible, then one can look at freezing of oocytes. But at least a number I would recommend is at least 14 mature eggs need to be frozen so that you can actually look at a semblance of a chance of having a child with these eggs. 1 or 2 eggs or less number of eggs do not really give you much of a chance, and this should be understood before somebody enters egg freezing for social reasons. The other big indication that's coming up these days is for cancer patients. More and more people are getting diagnosed with cancer and getting treatment at the right time at early stages, which is helping them to survive the cancer and then have a properly normal life later on. Except for the fact that cancer treatment is usually carried out through chemotherapy medicines or through radiotherapy of some sort. And many times these medications or radiotherapy permanently damages the ovaries. So while the person can survive cancer, it so happens that her ovaries are permanently damaged and she is rendered infertile for the rest of her life, and she cannot have a child with her own eggs later on. Now, if these women can be encouraged to freeze their eggs prior to starting the cancer treatment, then she can come back and use these eggs after her treatment is over and when she is ready for a child to get a child of her own eggs. This is something I would say is a wonder of modern medicine, and this should definitely be informed or be let known to as many people as possible that this is an option that exists today and is present here in the city as well.